Loyola University of Chicago Innovation Challenge Fireside Chat. It's a debrief after our fantastic innovation challenge that we conducted now about a week and a half ago. My name is Karin Hehenberger. I'm the CEO of Lyfebulb, and I have the pleasure to be joined here by two of our judges, two of our 5 judges, and 3 winners. We had one true winner in Ms. Katherine Grill, Dr. Katherine Grill, representing Neolth. And then we had 2 runners-up. We had Dr. Yair Saperstein with avoMD and Mihir Shah from UE LifeSciences. And our judges, Dr. Raju and Dr. Abigail Silva. So many doctors here. But beyond just their education, they're here to talk about what they actually do for others, because the focus of this challenge and summit was public health, addressing inequity in the system, focusing on healthcare delivery, and really trying to address or discuss solutions that had been shaped or formed or modified due to COVID, the pandemic that is still affecting us. But importantly, these solutions, technologies, services that were shaped and grown through that time are sustainable and are addressing beyond just the viral pandemic, but are here to stay. So our challenge and summit was an event that was conducted over several weeks and months of planning between the Lyfebulb and the Loyola University teams, Parkinson School of Public Health. And we sourced for technologies that applied companies led by extraordinary individuals who, many who had kind of been through these changes themselves and been inspired by them. And that's a clear differentiator, I would say, compared to many other innovation challenges where we really just look at the business, but here we look at the personal connection to the cause as well. And then we concluded with a 2-day event, virtual event, that where we had a fantastic judging panel that had the very difficult job of assessing these individuals. We had 11 finalists, and these 3 stood out. Even though I would think that the 2 judges here will say it was a difficult decision. So today we're going to talk informally, but very importantly with these individuals. And I'm going to first start by asking our judges to briefly introduce yourselves, even though you are very well known in your fields in academia and business and healthcare. We'll start with Dr. Silva.
Thank you for the introduction. I'm delighted to be here. I'm an epidemiologist by training and also health inequities researcher with years of applied public health experience. And it was an honor to be one of the jurors. I've learned a lot and I was definitely inspired.
Fantastic. Dr. Raju.
Oh, again, thank you very much. And it's a pleasure to be here. And I'm a surgeon by profession, but the last 20 years I've been working on the social determinants of health, how it affects the health outcomes as well as the disease process in this country to create what we call as a health equity. And I'm also of the opinion that you can't create health equity without a social equity, and you can't create social equity without addressing the social determinants of health, which are both physical, environmental factors, economic factors, cultural factors, as well as health literacy as a major factor. So I'm glad to be here. It has been a very great experience. And as Karin said, it was one of the very difficult decisions we had to make, choosing the winners. They were all like very, very close in absolutely passionate in what they do. Thank you.
Wonderful. Let's start with our winner, Dr. Grill.
Hi, everyone. My name is Dr. Katherine Grill. I am the CEO and co-founder of Neolth. I'm calling in from the Bay Area, a few miles outside of San Francisco. So really excited to be here today. The company that I founded is called Neolth. We're a youth mental health company. We've built a self-guided mobile app that's focused on providing stress and mental health support to teens and young adults, typically at the high school and college age. Really was founded based off of some of my personal experiences, seeing family members and friends really struggle with mental health, become hospitalized, and even some people pass away from preventable mental health issues. I ended up getting into the field, working clinically for a while in patient care, and then working in clinical research with a focus on adolescent and young adult behavioral health. And kind of long story short, as everything we do with the company is driven by the students, I think my career has also been very much driven by what my patients were asking, and they were asking for technology. They were asking for digital resources as a way to make mental health care more accessible. So about 4 years ago, I left my job at a hospital in Washington, D.C., moved out to the Bay Area without much of a plan, and then ended up founding this company. So it's just been a pleasure to be able to run the company, to work with all the students that we work with, and to be here today on this talk.
Great. Thank you, Katherine. And let's go to Dr. Saperstein.
Hi there, Yair Saperstein. I'm a co-founder and CEO of avoMD. avoMD is virtual clinical consults or virtual clinical consultants that empower clinicians to better be educated at the point of care and to better serve their patients. Guidelines and evidence-based guidelines are really hard to use at the point of care. And since medicine is constantly changing, for a clinician, such as myself, when dealing with a patient, it becomes extremely difficult to give the patient the appropriate care in a way that's standardized and actually allows for the patient to contribute to their care also, something called shared decision making. So what our tool does is it takes that evidence-based medicine and puts it into a format that makes it actionable. It allows for those guidelines to be used at the point of care. And because it's usable, that actually allows for patient input and allows for that whole care team, clinician and patient, to function at a higher level to optimize care with education at that point of care.
Great, thank you. And Mihir Shah.
Hi everyone, Mihir Shah. I'm the founder and CEO of UE LifeSciences. We are a women's health company focused on preventive oncology. We are making it possible for millions of women around the world currently don't have access to any form of early detection of cancer, be able to find that access in an inclusive, equitable, affordable way. And so what we've done is over the years developed devices and software applications and platforms that are making this possible in an innovative way with new technology. Our devices are currently available in more than 10 countries. We've reached almost 450,000 women in these places. And many of these women have never had a breast exam in their lifetime. So the work that we are doing is impacting women globally, and we hope to expand our work to new geographies and also to different cancer spaces. Thank you.
Great, thank you. So, of course, all three very worthy causes and important to different categories of the population. If we start with the title of our challenge here and considering what the pandemic did, can you talk, maybe we start with Yair here, what did COVID do to kind of fuel your company or to move your company forward?
So our company's idea is that you can take evidence-based medicine, put it into a tool that makes it accessible and actionable at the point of care. And this is something which I think minus 2-3 years ago, there were a lot of clinicians, a lot of doctors that said, yeah, of course I would access guidelines and reference tools on my computer or on my phone, but it wasn't something that was quite as universal. Fast forward to COVID, and people realize that there's really such a need to be able to take the evidence, which is constantly evolving, and put it into the hands of the clinicians at the point of care. And so this became something which not only was recognized as valuable, but was needed. And it's not just COVID, which is, the prime example of this, where the guidelines were changing about as fast as the virus itself. I think this is something which was really reflective for all of medicine through the lens of COVID. Diabetes management, hypertension, with its constantly evolving medicine base and guideline base and evidence base. And to put that into the hands of the clinicians who may have been in med school or nursing school 20, 30 years ago, or maybe 1 year ago, how do they get exposed to those new guidelines? And how do you ensure that they're going to be doing the right thing at the point of care? And from the perspective of the clinician themselves, such as myself, COVID really made it, how do I keep up to date with all of this in a way that's actually practically doable? And so I think really COVID shined a light onto both of these from the perspective of really good care, and then from the perspective of the clinician, how not to get burned out, but have access to all this information.
Great. Dr. Raju, being a clinician or a former clinician, how did you pick Yair as one of the runner-ups here? What do you think the value? How did you see the value? You're muted. I'm sorry.
So when we looked at his product and the way he's constructed that, how it was advancing the medical care and bring it up to, it makes it standardized, it makes it consistent medical care, and medical care based on evidence with good outcomes. So all those things are what we are aspiring in the healthcare field to achieve. So his particular application fulfilled all those things, and it was really a great boon to the practicing doctors in a time of need, and the information is available to them right in the fingertips at the right time and the right place. So that's why we thought it was a great innovation which will advance the care and the quality and outcomes of the patients.
I get that. When it comes to Mihir's technology and addressing global female health, Dr. Silva, do you and Mihir, I'd love to hear you debate the significance in the US. What do you think? How do you think this is going to work in the US, a country where women at a certain age do get mammograms?
Yeah. Could I just mention a few need gaps and
Go for it. Go for it. Yeah.
So I don't know if anyone knows this, especially this is for the audience. While every woman here in the US has access to a free mammogram, survival rate in Black women and Hispanic women is 40 to 100% higher from breast and cervical cancer. Women with dense breast, women that are younger than 40 or 45 years of age, benefit from these technologies in an inequitable way due to a variety of reasons, right? It's a complex matter. But what I'm focused on is the outcomes. And especially in the times of pandemic, did you know that every passing day, some 100,000 women were not able to access their preventive care for cancer on an ongoing basis for months and months? So these are just some pain points that I'd like to start with.
You could finish out on how that would benefit women in the United States. I think you laid that out really well.
So sure. I thank you. And so what we thought about for the first time, because all our focus was largely in developing countries, low and middle income countries, but we realized a few things very clearly. Number one, that pandemic is the big equalizer. Suddenly across the United States, there was a major need for women to access preventive health care through primary care or even by themselves. We also realized that poorer communities and underserved communities were furthermore disproportionately affected because they are anyways having poor outcomes when it comes to cancer. And so we thought about our technology and how its impact was being observed in developing countries like India and Mexico and other places. Why couldn't that be relatable and transferable to the clinics here, right here in the United States? And so we got in touch with a few care providers We had a conversation with them at different levels, at gynecology, radiology, breast oncology, and we realized that there was a lot of openness to make that solution available right here in the US, where women could access better preventive care right here in their doctor's office. And so that's what I'm focused on right now. Whether it's a pandemic or not, whether Omicron ends up becoming another major issue or not, to create a sustainable, infrastructure that is always available to women, whether in the primary care clinic with their doctor, or really at home, something that they could do on a telemedicine kind of a platform, a telehealth platform. And that's what we are working on right now.
Thank you. That's great. And I know Dr. Raju and I tend to look at things from with an equity lens, right? And so it's when we think about these kinds of innovations, it's sort of like, well, what are these innovations going to do? Are they going to exacerbate inequities somehow indirectly, or create a more level playing field? So ideally, an innovation like yours would be one that would be tested out or rolled out broadly, right, to everyone, right?
Correct.
We wouldn't want to see a 2-level tier of breast cancer care, right? Where some women only get some kind of innovations and not others,
Yes.
right? So it would be great as you roll out these innovations and test them out broadly, right?
Yeah.
So that there's equal access, and so that there's no thinking of, do I have access to this, but not that? Is one better than the other, that I don't have access to that? So
Right.
I definitely encourage you to think about those things as you roll about and you expand access to some of these innovations and testing them out more broadly.
Yes, 100% agree with you, Dr. Abigail, and also to measure outcomes as you're moving along, so that you can actually see the impact and the utility of the tools that you're making available. Because we don't want there to be mechanisms and machines just for the sake of them being there. You really want to be able to optimize the diagnostic funnel, so to speak, and triage women effectively, so that you are reducing anxiety, you're improving outcomes at the same time.
Go ahead.
The point Dr. Silva is making is a very important point. Unfortunately, we have seen the research in medical, especially pharmaceutical research, and the research in new cancer drugs, all the new stuff. Unfortunately, it only goes to people who are able to afford that in a way, so they are able to have a contact with the academic houses where they can be entered a clinical trial. Because most of the academic institutions not necessarily taking people who don't have money to enter the trial. So lots of times we end up, these great innovations only end up benefiting one subset of people. So the point we are trying to make is, as you got this, you have to find a way of making it easily available to everybody, so that they are able to be benefited by your innovations. And that is the purpose of this entire innovation challenge. It's not only just innovate, it's also by that innovation, you're going to help the health equity in this country. So that's the point Dr. Silva was making, and I agree with that completely.
Thank you. Let's go to Katherine or Dr. Grill. With your technology and your company, you're helping young people, and young people have been really severely affected, not maybe as much by the mortality and morbidity of COVID in itself, but the consequences of social distancing and social isolation in many cases, right? It's more physical distancing, since they can connect in other ways. And how has that affected different, I would say, communities within the young population? If we're again going back to the point of health inequities in the system, how do you address that? Please.
Yeah, thanks for that question. I think I think it's a complicated problem with a couple things to consider, that it's not just, I think a lot of people have been hearing about youth mental health since COVID, but it's actually really been declining if we look at the past 5 or 10 years. And with some of the recent news that's been coming out around, for example, social media and the impact on youth mental health, we can really see that decline. So I think it's been something that has been going on for a while. And then all of a sudden COVID hit and it's just made everything worse. More anxiety, more depression. Mental Health America had put out a report, I believe it was December 2020, and they interviewed 11 to 17-year-olds and found 51% were suicidal, which I found very alarming. And they're not the only ones. There are a lot of other publications who are reporting really sharp increases in suicidality, and we've seen that also in the schools. A lot of, unfortunately, suicide attempts from the students. So it's been, as a clinician, I think something that's really alarming and that urgently needed to be addressed. And I think the problem is around, health equities. What we've always seen, especially within the schools, is who is able to address that? Who is able to have the resources to adopt more counselors, adopt crisis counselors, crisis resources in their schools to be able to help their students? And I think, we've seen this in the schools historically, not just around mental health, but other resources that they have, depending on the area where you live, the school district where you live, and the funding, that some schools are just having so many more resources than others. So for us, it's really important to try to figure out how can we support these kids with preventative health care, really teaching them time management, stress management, all the things that are just so important to thrive, as well as how can we help those who are already in crisis and do real-time referral, especially considering if, maybe they're in a school district who doesn't typically have those resources. So for us, being able to wrap this into a technology solution where we have a mobile app where, we have all of that content that's kind of self-guided for the students, but then we also have a natural language processing system that can identify students in crisis and do a real-time referral. That's, I think, really important for us to be able to make both of those things, the referral and then also the kind of prevention, scalable, accessible, highly affordable for the school. We're talking about a couple dollars a student for 12 months a year. And, important that we're not asking the individual students to pay for it, but typically the school and the school district. And with all this COVID relief funding, there's been about, I think, $190 billion funneled into the schools for different student support services. So we're really starting to see more funding become available, even to the schools who traditionally didn't have funding. So I think that that's, exciting thing for us to see, the kind of availability of funding in schools who didn't always have it, but also to try to start. I want to be conscious about that, not fixing everything, but just trying to start to level the playing field in some of these schools who have been really underfunded and under-resourced for a long time.
So one thing is the access, and I think that's a good answer because larger classes of kids with less resources, there's going to be just less help on average. But what about cultural differences and where there are some minorities that perhaps it's just not accepted in their culture to reach out for help, and their families may not encourage it, rather discourage it. So the children need to go behind their parents' backs. How do you deal with that?
Yeah, I think that's something that's important to consider anytime we're thinking about access to care and mental health. But definitely, as you mentioned, with the youth who have this other layer where, their parents might be involved. And we've heard that a lot from young people where it can be really difficult to access therapy, not only because it's so expensive, but then you might need the parental consent, you need your parents to pay for it. So by going through the schools, we've been able to, in some ways, sidestep that problem where they're getting the resource from the school, it's being integrated into the classroom, it's coming from the teacher. So it's something that's just available to all of the students. We're starting to normalize it, and they're not having that issue of, I need to first discuss with my parents and have a conversation about mental health, and I'm not sure how to go around that. But it is really important to think about those different cultures as well. And this is really where we brought in the young people themselves to have discussions with them, because you never really want to assume that you know how anyone is going to react from, a certain age group, a different culture, the intersectionality of different identities. communities. So that's why we built up this ambassador program, which is now a couple hundred students. 88% of them identify as BIPOC, so a pretty diverse group of students. A quarter of actually the students who are on Neolth using the platform identify as AAPI, so that's a really large group where we've seen a lot of engagement, and we've heard specifically around stigma in the culture. One of the ways that the kids typically say it is, my parents don't believe in mental health. So that's what we're hearing, this is going on in the household. So really thinking about, okay, well, how can we, if there's an issue with accessing care within the household, how can we maybe get them to access that care in the school? How can we include resources on our platform that are made by people from their cultural background, whether it's doctors from their cultural background, other students from their cultural background, specifically talking about that stigma that they experience in the culture. And then the next thing that we're thinking about is, well, okay, then how can we start to have some of these conversations bleed out and integrate into the home and what the parents are doing as well. So working with some of these ambassadors actually on like a parent resource guide, and how do we start to have conversations with parents? How do the teachers have conversations? How do the students themselves have conversations? So, it's a complex problem. I think there are a lot of different steps that need to be taken to really address this. But the most important thing is that we're really working with stakeholders from those communities to try to understand what those cultural barriers are and how we can take steps to overcome them.
Yeah, you're creating a product for these individuals, but also integrating them in your creation and having them as part of the process. That's very important. Dr. Raju, did you have anything?
Yeah, sure. Yeah. Dr. Grill, we looked at your product and we were very impressed with what you are doing and how much it will be helpful to the students, right? So I just want to suggest, as a part of it, we had some discussion that we could probably be helpful to people to expand their understanding of this better. We have seen by our studies about 5 years ago that most of the kids, adolescents, whether they commit suicide or attempt suicide, or even some people have school violence, they all have a pre-incident social media postings. So if you go back at them, there is a lot of social media posting which basically kind of detects that this person is going down the track and he's going to end up in a part of it. So we always wondered if you have an AI in that social media, so we are able to identify that this person is actually going, which you are trying to do with your questionnaire. If we can implement that at a higher level, we'll be able to do an intervention much more better. Because when I looked at the last incident, 87% of the people who committed suicide in that age group, they have some social media posting before that, either indicating that what they're trying to do, or they're expressing some kind of social isolation or something to the effect. So I think there is a potential opportunity here. If you can convince this big tech giants and saying, something, social media could be responsible, it could be helpful to doing this in a part of it. So that will be probably a part. Of course, you have a large privacy issue comes into picture. I understand that. But somewhere we need to really balance it out, so because you have to save so many lives by doing that. So I just want to think about that concept, how we can enlarge it to a much more wider population.
That's a fantastic point, and it's something that we've been thinking about as well. If you look at, like you said, suicide attempts, school shootings, I mean, it's very often posted publicly before it happens. And it was, I think, a point of frustration for us. Why aren't these big companies moderating this more? Why aren't they able to pick up on it? And I know that they're doing some work, so I don't want to say that's not happening at all. But we felt like, well, this is something that's really important with the increase of suicidality, so let's really try to focus on this. We have built a natural language processing system that can do just what you were discussing around identifying crises and making a real-time referral. For now, we've kept it on our platform, so when the students are, for example, journaling on our platform, it's able to pick up on that. But we do today have an API, which means that we could, for example, expand this to other things like social media. And I think you bring up important topics around, privacy, concerns around that, the legalities associated with this. And we just want to be really mindful as we start to expand how we go about that. So if there's anyone on the panel or anyone in the audience who's listening who really has some expertise in those areas, would love to connect, because that's something we're thinking about, is really balancing that, the privacy component with that ability to save lives. And I think there's a lot of conversations to be had around that for sure.
Anyone on this panel has any comments? Just because this is something that we all think about, right? We're thinking about being monitored, what we put on social media. What do people use it for?
I would probably also reach out to ethicists, right? Bioethicists. Loyola happens to have a great center in bioethics, so I'm sure I could help you, or they could help you refer to something, but how to think about these issues and what are our moral responsibilities as well.
Good collaboration.
Yeah.
Yair, if I wanted to ask you, you have this great trajectory, and I think what you've built, just in a very short period of time, while you're also, managing your clinical career. What do you think is the biggest need for you to be really successful? What is it that you need right now? What would you like? What is it that you were looking for in partnering or acquiring to take avoMD to the next level?
So we're doing a couple of different things. One is we're integrating more deeply with the electronic health record. And so in that aspect, we have some interoperability companies that have offered to help in that deeper integration, to be able to have the standards of being able to speak to different EHRs. So that's one. Second, which might be even more relevant for those who are in the audience and here, is inherent within the guidelines are the medical devices, the pharmaceuticals, other companies' products that are standard of care, but until they actually reach the clinician at the point of care, they might be unrecognized, even if they are the best treatment. And so we allow for distribution sponsorships of our content so that we can give it to physicians at no cost. And so if you're part of industry, be it pharmaceuticals or medical device, and have an interest in helping us with this path, we'd love to be able to speak and have this sponsorship opportunity. And then I think the third biggest need is a product which is wonderful, but with no one to use it, doesn't exist, just as a tree that falls in the forest with no one to hear it necessarily. And so this product, as we are continuing to build up the content and as we're continuing to build up its use, I really speak to anyone who's involved from the hospital or clinic or telehealth company administrative side, where if you would have an interest in integrating this product into the workflows of your, we would definitely love to be able to do that also. So I think those are our three biggest needs now to continue on our trajectory forward.
Great. Well, thank you.
Karin, if I might also add, I think that for me personally, one of the exciting things about Saperstein's innovation was, again, looking at this from a health equity lens, we know that there's racial variation, right, in healthcare utilization and the provision of evidence-based therapies and so on. So the idea that this could be medicine that could be delivered, again, evidence-based medicine could be delivered more systematically across populations, really has the opportunity to decrease that variation, right, that disparity in evidence-based medicine across populations. So that's really exciting.
That's the social impact that we talked about a week and a half ago that is clearly there, a potential for it being there. Very good. So Mihir, for you, you're doing all these different events now, trying to raise funds and getting out there. What are you looking for to bring even more success to your company?
So we are going to be making a very exciting announcement in probably less than a week from today. And so I'll keep everyone guessing for about a week. Sorry about that. But my focus really right now is how can we enter the US market and expand our technology throughout the US market, specifically to reach minority populations, women of color, underserved populations, where disparity metrics are very clearly laid out. US has a very good, CDC and others publish this data, so we know exactly where the needs are. And the second thing that I'm most excited about is how do we make our technology to be accessible to women at home? That's another place, because see, with breast cancer, there is so much awareness everybody has. There is no lack of awareness. As I say, it's the most celebrated disease in the United States. So there's no lack of awareness. There is really no social stigma around it, at least in Western countries and developed countries. You just have to build the technology in a responsible way. We know that our tool is effective and clinically useful, but how do we represent the information to women, right? When they use this at home, how do you connect them to their care provider? Even if they don't have a regular ongoing doctor, how do you get them to speak with a care provider? These are the things that I'm thinking about. But really, broadly speaking, how do we make sure that we get to every woman who deserves access to this, which is every woman? And so focused on that right now alongside, and capital is one of the big enablers that make that happen. So working to raise that right now.
Yeah, great. I wanted to ask you now, all three of you, and perhaps also our two judges, if you think about the younger generation. I mean, some of you here are younger, but not, they're really young generation, in sense of leaving school and wanting to become an entrepreneur. How would you guide them to be successful? What is some advice that you've accumulated? Most of you here, all of you here, have studied, for a long time. You've accumulated a lot of information over the years before you started your venture with what you're doing. And there are entrepreneurs who start in their garage without any education. Is that the way to go? What is the core of an entrepreneur that you think you all have in common that you'd like to give, to inspire, and to give that inner strength to others who are looking at you now and saying, I want to be like that when I grow up? What is your advice? We'll start with Katherine, to all those young girls.
Absolutely. It's funny you ask this, because I do get this question quite a lot. As you can imagine, we work with young people, and I'm very flattered, when they say that, I want to do what you're doing. And I want to be really open with them about the benefits and probably all the good things that you see online, and then all the, as we know, struggles and difficulties and ups and downs of being an entrepreneur, because it's not all about the good news that's posted online. So one thing I really say to young people is, why? Why do you want to be an entrepreneur? Is it something that you feel like you've had to do? We have a lot of young people who feel pressure from family or parents, like this is the only career path that they can have. And that's, I think, sometimes, a difficult conversation that needs to be had. Is it because you're really wanting all the, again, they see things online. I think sometimes LinkedIn is like the Instagram of the business world, where they're seeing all these great posts and they're feeling like, oh, I can be an influencer. Is it really for wanting that? Is it wanting, is it about the money? I do talk to a lot of young kids who think, it's really an opportunity to make a lot of money. And we start to kind of dive into their priorities and really kind of weave it out. And I think what it comes back to is the passion. And curious to hear what the other founders on the call say, but there, again, are things that are posted online and all the good publicity that we get. And for every good thing, there's probably 10 to 20 no's. And I think when you're first starting out, it's 100 no's, right? For every one good thing. So you really need to have that grit and that passion to be able to wake up every day and get, 15 no's in a row and still continue to go, because you are so driven and just absolutely need to do, what this company is about and follow through on the mission. So I think that's a really important thing, is to just take that step back and think about, well, what are my motivations for doing this? Am I willing to be okay with the ups and the downs and some of the sacrifices that come with it? And just be really, I think it's on us as the entrepreneurs to be really open and transparent about, it's not just what you see online, but there are also a lot of these challenges as well.
Mihir.
I was just thinking something. I blurted out loud. Let's see how it comes out. I think that entrepreneurship is kind of like having friends. You choose the kind of friends you want in life. Working is like having family. You don't get to choose. You kind of have to work, and many people are employed at places that they rather not be at. So I would say that, you pursue entrepreneurship with your heart and soul and sort of, all things, because that's a field of passion. And I teach a course at Drexel. By the way, the night we won, both Yair and Katherine took time out that very night to meet with my class that night after they won. And it was awesome for all three of us to speak with my class, and Katherine and Yair. I've said thank you to you. Thanks again. And what we said to our class was, fail early and fail often. If you're going to pursue something, start as early as you can, because in this, you get one lifetime, and entrepreneurship is all about, staying in the game and not giving up. And so you're going to make your mistakes. The earlier you make them, the more resilient you are. You can get back up and get ready to make more mistakes again. And never, ever be discouraged because you didn't reach there for the first time or the nth time. It's just about keep doing it and never giving up. So I have a very, Churchillian view towards entrepreneurship of never giving up. That's my message.
That's great. We got passion, we got grit. What do we got from Dr. Saperstein?
From my side, there are two take-home points. One is seek out mentors actively. Find those who will support you in this journey, who will guide you in this journey, and actively seek them out. The second is a little bit more passive, but keeps you more on alert, which is grab opportunities when they come. You don't need to seek out opportunities as actively, but keep your eyes open for when the opportunities come and don't let them pass without taking them. That's held me and has held a lot of the mentors that I've spoken to and actively sought out in this journey.
Fantastic. I love that, because we've got three entrepreneurs and we got three, different pieces of advice, and they all are incredibly obviously true because you're giving them. But I can see how they resonate. That's wonderful. Abigail,
I'd like to add in. It's funny when all three were speaking, I'm like, oh, it's the exact same thing for a PhD, right? I mean, you definitely agree it. You need a thick skin because there is rejection, right? There's rejection of papers, there's rejection of grants, and you have to get back up, and not give up. Mentors also play an important role, and the passion, right? We're not in it for the money, really. It's because it makes us happy and we believe in this, and that's what drives you at the end of the day. So, yeah.
My comment is that, whether you're an entrepreneur or innovator or social change agent, wherever you go with that, I'm always interested in this quote, which says that some people look at the things as they are and wonder why, and some people dream of things that never were and wonder why not. So that is attitude, right? That you two ways of looking at it. Oh God, the healthcare is falling apart. This is what happened. And say, why are it happening that? And you guys look at it and say, why not? Why can't we do something very different? So I believe in more than all the things you talked about is important, but most important thing is the attitude in life. That you have to say, I will not accept the status quo. I am going to make a change. And that change is going to come because I'm not going to be somebody who will be wondering what happened around me. I'm going to make sure that it changes what happens around me. So I think that is the point. I think whether you are a application, genius, or is a computer specialist, or a social change agent like Dr. Silva, are trying to make a difference in people's lives, I think that's what they all share in common. So that's my final comment from me. So thank you for this opportunity from you guys.
I love that. I think that's a great concluding comment. I could not agree more. I think entrepreneurship is about being rule breaker. It's not about coloring within the lines always. It's about finding that idea, going for it. And then, of course, you got to stay the course. You got to stay the course. You got to not give up. You got to believe in it. You got to believe in it strongly. But that idea is a novel idea if it's going to be a great company or a great thesis. You know, when you do research, it's the same thing. I agree with the PhD concept. So wonderful. I feel honored to be with you here today. And I hope we all stay in touch. And I want all of these technologies and companies to do very well, because I think you're addressing very vulnerable parts of the population. And I think what is important, what we have, I think, got to today that we may not have got to a week and a half ago, is that how aggressively you are actually considering the vulnerable in the population, in addition to making your companies successful as entrepreneurs. And that's exactly what this challenge was about. So thank you again to our winners. Thank you to our jury members. And of course, thank you to Loyola University and the Parkinson School. So with that, I will conclude this fireside chat. Good night.
Good night.